in PRI, the hardest thing to understand is the head and the neck. And there is one particular aspect of PRI that is by far the most important to understand, because it could be the reason why techniques and exercises that work with other people simply don't work with someone with stubborn pain or just who's kind of suffering and in misery. And I'm going to have to explain it through my experience, because I was one of these people. I had limited ability to get neutral in my body through normal PRI techniques. Now, I did unlock my pelvis, which was a great thing because my SI joint issues pretty much disappeared. I never had another blowout again. I still had upper body issues, but compared to the SI joints and compared to the plantar fasciitis that I had many years prior to that for 4.5 to 5 years, everything else is just minor annoyances. Can be painful, but not, just something I could live with. It really wasn't a big deal. The SI joints and the neck spasms, that was the big deal because it was just constant over a period of 14 years. It just seemed like my SI joint would go out on me, I'd be out of work, off my feet for a week, then I'm finally feeling better, and it's misery because you can't move, you can't sleep, you can't do anything. Then, a month and a half later, I'd get a neck spasm that would always start on the inside of my right scapula, and it would very slowly just spread, and it would just your whole upper body, your whole thoracic spine and neck just freeze up, and it's almost like pushes you down into the ground. You can't stand up. It's freaking brutal. And this just kept happening for years and years and years and years. And the reason was because my spine couldn't move. So let me just show. I'm not going to get too much into the biomechanics of it because there's just too many things to address. But what happens is, in someone with a cranial pattern that's deemed a right torsion, and that's the more serious pattern that PRI deals with, particularly in cervical revolution, which I've taken 4 times, I might take a 5th, not positive. The right torsion is a pathologic state. Because your body has done things that it shouldn't do in order to find itself in this position. So it's kind of broken the rules. In this position, your body is in extension. You're arched in the lower back. Your rib cage is flared, probably on both sides. And in order to stay straight or to maintain a horizontal line of sight, your neck has to come forward. So you have that forward head posture, which is really forward neck posture. The head just goes for the ride. So here's the cervical spine, the neck, and here's the base of the skull. When you end up in a forward head, forward neck posture, for any reason, it can happen for a bunch of reasons. In the front, it flexes forward. Now here's your skull. Here's your eyes. Your line of sight is now down, so in order to keep a horizontal line of sight, the base of your skull, the occiput, has to extend. Now it's causing compression on the atlas, which is the top cervical vertebrae. And when you have an extended occiput on the atlas, you don't have frontal plane range of movement, and you'll probably be limited in transverse movements also. And that's what you find. You find an inability to rotate the head and neck appropriately, and you find, and not only at the head, but also at the entire cervical spine, because your cervical spine needs to maintain 30 degrees of lordosis. It needs to maintain a normal curve, just like your lumbar spine has to maintain that normal curve. But in the cervical spine, it becomes extended or complete. It flexes forward, and then it puts the neck into a state of extension. It means it's straight, reversed, whatever you want to call it. But now it's compromised. It can't move. It can't side bend. It can't rotate appropriately. And this straightness up here affects the spine all the way down, from the thoracic spine all the way down to the lumbar spine. So your spine, from the base of your skull all the way down to your sacrum, and that of obviously sacrum SI joints, where the sacrum intersects with the iliums, that's your SI joints. it's all compromised. You can't move. I mean, you can move, but you're compromised. So what happens? The most important thing is your body loses the ability to rotate appropriately and effectively. Rotation is what makes us human. The ability to rotate pushes us forward as a human is pushed forward. It makes us very maneuverable. We can adapt to many different environments, different circumstances. When you can't rotate, you become stiff and rigid. You have a rigid spine. You look over your shoulder to back out of a parking spot and your neck seizes up on you. You try to swing a golf club and you go down with SI joint pain. Why? Because your spine, if it's extended, an extended spine can't side bend, can't laterally flex, and a spine that cannot laterally flex cannot rotate appropriately. So it's just, you're rigid. You biomechanically, you're stuck. And now, instead of having a right side of the body and a left side of the body that alternate, you have one body, an extended body, and you're stiff. And you can't go from right to left, from right to left. You can barely even get right, much less get left. You're just right in the middle of the road, and you are highly susceptible to injury. You are highly susceptible to really weird autonomic issues, maybe ringing in your ears like I have since I was 13, although it's been greatly decreased in the past year and a half. You can't breathe. So a lot of this goes back to airway management. Number one on your list of survival guides is you have to keep your airway open, a neck that comes forward. You will have a compromised airway, so what you have to do is you have to open your jaw and push the jaw back. So it can happen either way. The jaw can end up slightly back, and then so a retruded jaw goes backwards. When a head comes forward, the jaw moves backwards. So if you're stuck in that position, the jaw is back. And now you have a bite issue because now you have aberrant tooth contact because your jaw moved back because your head moved forward. Or it could happen the other way. For whatever reason, your head comes forward, maybe start at the pelvis and you just extend it all the way up. Your head comes forward, the jaw moves back, and you're stuck in this position because you have to keep it there in order to breathe, because your airway otherwise, if your jaw stayed forward when the head is forward, you can't breathe, the airway's closed. So the jaw has to recede or retrude, and that opens up the airway, so now you can breathe again. But you've caused an issue. Now you're locked in, because when you have a forwardly or anteriorly flexed neck, you put these big SCM neck muscles in a position they can't shut off, and they attach to your sternum and they pull you up. So you're now using them to breathe, so you can't use your diaphragms. You breathe like this. You have a neck strategy, so now you're locked up even more. So once you're in it, you can't get out of it, and you don't even know it. So, oh, I lost this. Uh-oh. Let me keep that on. At any rate, see, when I get animated, I lose my microphone. Hopefully this keeps working. So let me just go over the most important points. When you are a right torsion, you are an extended body. You're compromised, your movement is compromised, your neck and spine is compromised. The movement of your entire body all the way down to your feet is compromised. That's why you'll find a lot of right torsions who have supinated feet. They can't pronate. Pronation is relaxation and expansion. Supinated feet are extension and tension. So they're living in a supinated foot position. They walk out with their weight on the outside of their feet. They never get pronation. I was that person. So that's why a lot of them, impingement and instability seminar that I've taken 3 times, you learn about that, but that all goes back to the head and neck. All right, you become completely ungrounded because you're using your neck to pull up when you breathe, and that ungrounds you, so you can't sense the ground properly through your feet. But you can't sense the ground properly through your feet if you're using your neck. If you're using your neck, you can't get those feet to pronate because you're stuck. And if you can't sense the ground, the neck won't relax because you're ungrounded. So it's this two-way, you get stuck in a vicious circle. That's why everything has to be addressed at once. That's why a lot of people need foot orthotics, what I'm going to get to, the acrylic mouth guard, and sometimes even visual integration as well. So closed airway, you're promoting accessory neck breathing, you're extended, you're rigid, you can't rotate, you can't move, you're very susceptible to injury. Life sucks, you're constantly in pain. You get SI joint issues, neck spasms, pain all over the body, and it's misery. I've been there. The OA joint back here is compromised. You could have brainstem compression. The vagus nerve could be compressed. Other cranial nerves could be compressed, and that's where life happens. Because you have so many important autonomic nervous system nerves that come out of that area, they could be compromised. Congestion, difficulty swallowing, breathing issues, obviously. So that's pretty much the issues with it. In order to get out of it, this is where it gets complicated. I can't help you. Not through video, not through emails or anything like that. This is where you need somebody because you're most likely going to need one of these. And why? This acrylic mouth guard. A lot of people, and I'm just going to read, oh shoot, I should have opened it previously. A lot of people who end up in the right torsion, let me just read because this is basically it. Often this pattern reflects and represents history that includes whiplash that causes a protective fight or flight position of your neck, and then if that never gets released, it goes all the way down to the rest of your body. Represents history that includes whiplash, visual instability, significant malocclusion, like a crossbite, chronic anteriorly repositioned TMJ discs, head trauma, and dysautonomia. The reason you need this is if you have a malocclusion or a crossbite, and it is reflecting a system that has shifted. Your temporal bones have shifted, the base of your skull has shifted, overactive neck muscles may have shifted your jaw to one side or the other. You have a crossbite, you don't feel occlusion on one side, you never had occlusion on one side. There's a lot of reasons this can occur. You have something called an HMBA, which is the habitual mandibular bracing area. Just call it your home base. So if you were to clench, and your teeth come together because you're about to push something or lift weights, and you clench, that's your home base area. That's your habitual occlusal area. And you organize a lot of muscle movements around that, especially if you have to brace. So the home base is where you go, where your brain goes when the postural system needs stabilizing for applying external forces. So if I have to do something that requires any type of exertion, that's where I go to organize my ability to stabilize my body. And a lot of people use, because of this neck or instability somewhere else in their body, like the anterior hip, pathology in the shoulders, it could be pathology anywhere where you're unstable. You may have to make up that stability through clenching or using your jaw and masticatory system. For instance, I have a crossbite, or I had a crossbite. That's how I braced. That's how I was stabilizing my neck. Once I got out of my right torsion, what prevents me from going straight back to that crossbite to start stabilizing? Because remember, when you do something like this, you're actually destabilizing your body, which you need because the way that you're stabilizing is killing you. So you're destabilizing your system, but your brain's like, I'm destabilized. How do I live now? It's going to go back to that crossbite because that's what it's its habit. It's been doing it for so many years. That's the only way it knows how. This acrylic mouth guard, they're expensive. They can be anywhere from $400 to $1,000, depends on where you live. You put this over the bottom teeth, and this, so now it gives your brain proper reference, molars, proper reference for how to use the teeth and muscles of the neck and jaw appropriately to stabilize your body. Not to stabilize your body. It allows the PRI exercises to stabilize the body naturally without you resorting to that crossbite again and using your jaw and neck muscles to stabilize incorrectly. So it keeps you neutral It keeps your head and neck neutral, your body neutral, so that you can restabilize your body through PRI exercises. Otherwise, you can't override this. You can do all the exercise in the world, but you're still going to go back to this crossbite or whatever that malocclusion is that your body has a habit of using to stabilize. So it's preventing you from going back to that prior habitual stabilization pattern, that HMBA, that was inappropriate. We want to give you an appropriate HMBA, and you need this to override the old pattern. It's just another pattern inhibition, just like the left AIC, right BC, right TMCC. You just have to override that habitual pattern and give it a new pattern, and that's what this does. If this is included in your life, you have to see someone who knows what they're doing, because even legally, they have to be able to work with a dentist, most likely, to make this and then get it calibrated or equilibrated, however you want to call it. Sometimes it has to be taken down as your bite changes. This might have to get shaved down a little bit to reflect that. Otherwise, it might be too big and then lock you up again, because it's keeping you tight. It's become too big because your jaw's changing, your bite's changing. And that's why you have to take cervical revolution. If you're doing PRI and you can't figure out why things aren't working with some people, they might be these types of people. They will not everyone is a right torsion. This is not only about right torsions, but there's other issues going on in the head and neck that won't let typical PRI intervention resolve the issues when it does with other people, and you can't figure why. It's usually coming from one of the major sensory inputs, which is teeth, feet, or eyes. Less likely eyes, a lot of teeth, and a lot of feet. And the feet, of course, as I've shown, you can do a lot with that. But teeth and feet, a lot of people, interestingly, I know this is going on a little bit longer, but a lot of people will have more occlusion on the right side. They'll feel the right teeth more, the right molars more. And if that's true, then ask them without their shoes on, where do you feel your weight on your right foot? They're likely going to say their right heel. And they're not going to say the left heel, and they're not going to say the left molars. It just reflects this right side pattern of overuse, particularly with that right SCM, that you can shift the jaw forward slightly, and that can create too much occlusion on that right side. So there's a floor down there, a ground down there, and a floor here, and they have to match up appropriately. And for people who don't, over time, the longer you're in a pattern, the more likely you are to end up in a type of cranial strain pattern that can cause major issues down the line. So that's why you got to learn cervical revolution to understand what's going on with people that you are not having success with. If you found this video interesting or helpful, could you please like it, share it, subscribe to the channel, do anything you can to spread this information, because PRI is really changing people's lives, and I hope to share it with even more people. Thanks.